Welcome back to MedBites, Transplant Rejections. Before we proceed with this video, it's important to know that transplant rejections build on the concept of hypersensitivity reactions. So before this video, make sure you understand hypersensitivity first. All right, let's get to it. There are 4 types of transplant rejections, but 3 of these are high yield. First is hyperacute. As the name suggests, it happens fast, within minutes to hours. All right. The mechanism is that the recipient already has preformed antibodies against the donor's antigens. So the antibodies attack immediately. And again, going back to hypersensitivity, we said that antibodies constitute a type 2 hypersensitivity reaction. The kind of example you will get is that someone had a transplant, let's say kidney transplant, right? Someone had a kidney transplant, and then as soon as the surgeon puts it in and connects the vessels and everything, there's diffuse bleeding. What is happening? The body is immediately rejecting the organ, right? It's immediately attacking it. So what kind of transplant rejection is that? That's going to be hyperacute. Okay, the next one, acute rejection. This one happens weeks to months after a transplant, and it's mainly a type 4 hypersensitivity reaction. Oh, that's a Roman 4 IV, but okay, let's just put T4 here. Yeah, type 4 hypersensitivity reaction because it's completely cell mediated. Recipient CD8 and CD4 cells attack the donor's MHC molecules. The classic step 1 question would be someone gets a lung transplant and then weeks later they develop shortness of breath. And then when we do a biopsy, we see interstitial lymphocytic infiltrations, and then they'll ask you what is the underlying mechanism. So that would be CD8 or CD4 T cells attacking donor MHC, or they'll ask what kind of transplant rejection this is, so you know it's acute. Time frame matters. Time frame does matter. All right. And what's the treatment? Immunosuppressants. That is why we give immunosuppressants to people with transplant. Okay, now let's talk about chronic rejections. This happens months to years later, and think chronic rejection as chronic inflammation, the same concept. So chronic inflammation leads to what? Fibrosis and vascular narrowing, eventually causing graft failure. Now, the most high yield part that you are going to 100% be tested is graft versus host disease. And for this, we're going to make its own slide. Okay, graft versus host disease. Usually, this happens after a bone marrow transplant or liver transplant. Why is that? Because the bone marrow and the liver are rich in lymphocytes. These two are rich in lymphocytes. Okay, now what is the mechanism? The mechanism is that the donor, as the name suggests, graft versus host. So graft is the person that donates, host is the person that receives the organ. So the donor or the graft T cells attack recipient tissue. Okay, and usually it's going to be bone marrow or liver transplant. So they'll say patient either had acute lymphoma, right? Sorry, leukemia, or it had some kind of hepatocellular carcinoma and needs to be, removed, or like has history of alcoholic cirrhosis and is getting a liver transplant. So that's going to be the type of questions you get. Classic presentation is going to be rash, diarrhea, and potentially jaundice. Okay, and yeah, so this is graft versus host disease, and it's a type 4 hypersensitivity reaction. And there's that.